This call is now being recorded.
Hello, my name is Thomas Bunker. I'm very fortunate to have been able to design and conduct a clinical trial for long COVID. I myself have been suffering from and battling long COVID for over 5 years. Early on in my long COVID journey, I noticed some benefits personally from switching to a no sugar diet, eating in a time restricted window, and uh, and I started doing some short fasts, and it seemed to really benefit my symptoms. I started a Facebook group, and I had a lot of people join, and I collected some preliminary data indicating that this regimen might be helpful to treat many long COVID symptoms. But anecdotal reports don't cut it in the scientific world. So I was fortunate because I had a PhD. I was able to team up with Dr. Jeffrey Novak and some other researchers and run a real randomized crossover trial to look at the effectiveness of two different degrees of intermittent fasting. And today I'm happy to share our positive results with you. So I'm going to jump right to the end and tell you this is what positive results look like for a long COVID clinical trial. This is a graph showing the percent decrease in the symptom occurrence or the symptom frequency for 28 of the common symptoms that we tracked. So you can see some of the symptoms. So this is over the entire 10 weeks of the trial. So 6 weeks of time-restricted eating and 4 weeks of a narrower eating window and a once-a-week short fast and a no-sugar diet throughout the entire 10 weeks. And this is what happened, looking at the frequency of symptoms from when participants started to the frequency of symptoms that participants had 10 weeks later. You can see that blurry vision and ringing in the ears were the most resistant. Those only went away completely in 20% of the participants. But you look down at the other end, hot or cold hands and feet, chest pain, light sensitivity, sensitivity to loud noises, nausea, those went away in more than half the participants. So this is not a cure, but this is a very positive result. We weren't just treating fatigue or just treating cognitive fatigue. We were attempting to treat everything. Okay, so how did this start? So as I mentioned, I had this Facebook group that was focused on fasting and diet to improve long COVID symptoms. I was able, through some informal symptom surveys, I was able to get some preliminary data and teamed up with Dr. Novak, and we got IRB approval to do this, to do a real, scientific study. And being a patient myself, I wanted to be this to be as patient friendly as possible. No, we couldn't visit everyone in a horse and buggy, but we did the modern equivalent, which is, we took advantage of the internet. Anyone residing in the US was eligible to participate, and everything was done online via video conferences or via simple symptom surveys and emails and texts, etc. So this is how we reached out to the very sick long haulers. And basically what we want to know, what are your patient reported symptoms and how bad are they? So it's a common sense approach, right? It's an ambitious approach, but it's a common sense approach. We also tracked symptom flare-ups, and we asked a very simple question in the enrollment process, and that is, did your long COVID symptoms first start soon after vaccination, i.e. hours, days, or a week or two within COVID-19 vaccination? And incredibly, 30% of our participants said yes. Okay, we used a crossover design, which is kind of a interesting design. It's not a parallel arm, placebo-controlled gold standard trial. It is a crossover design. So it's kind of like comparing potential treatment A versus potential treatment B, and it's like an old-fashioned balance scale. And the same people do both treatments. They do A and then B, or they do B then A. And this means that we don't have a control group because the same individuals do both potential treatments. And it's actually statistically more powerful than a parallel arm trial. So we had everyone adopt a no sugar diet, like go off a boatload of supplements and eat in about a 10-hour window per day. And then half the people in one group, continued that for another 4 weeks. So that was the 10-hour time restricted eating. And then they ended with going to a little bit narrower eating window and doing one short fast per week. And that was, they were aiming for a night, day, night fast of about 36 to 38 hours. Or the ambitious ones could aim for a 2 full day fast, 3 nights, 2 full days of about 60 or 62 hours. Not surprisingly, the majority of people ended up opting for the shorter fast. And some people, like would just get 20 or 23 hours into a fast and have chest pains or some other concerning symptom flare up. And so, of course, they could stop fasting at any time if they were concerned about what was happening in their body. And we did weekly symptom surveys at the very beginning and every week in the trial until the end. And the timing of the surveys was that they would do the short fast kind of at the beginning of the week, and then 5 or 6 days later was when we would assess symptoms, because we were trying to assess baseline symptoms as much as possible, and trying to avoid, the flare-ups of symptoms as much as we could. We did not have a washout period. If I were to do this over again, I probably would include a 2-week washout period. Okay, so the heart of what we did was measuring symptoms. We tracked 60 patient-reported symptoms in language that patients can understand. And we had 32 checkbox symptoms. So things like balance disorder, difficulty communicating, no taste or altered taste. They just simply checked a box if they had that symptom on the day that they took the survey. Otherwise, we tracked the severity using this slider shown here in the screenshot. And for example, fatigue. Did they have mild, moderate, serious, or severe fatigue, or none at all? And then each severity value was assigned a point value. So for example, this participant had moderate fatigue, serious post-exertional malaise, mild headache, and serious brain fog. So that translates to 2 + 3 + 1 + 3 points, plus they get 3 points, 1 each for each additional checkbox symptom, and that gave us this long COVID severity score of 12. That was one of our primary measures. The other measure was just simply counting the number of symptoms So in this case, if this was all the symptoms that patient had, they would have number of symptoms would be 7. And typically the long COVID severity score was about twice the number of symptoms. So the baseline characteristics were typical of most long COVID symptoms, most long COVID studies, where we had 72% of the participants were female. The average age was 49 or 50. Most of the patients were not overweight. The average BMI or body mass index was 25.5. And the mean duration of long COVID was 24.6 months. So in other words, more than half the participants had their long COVID symptoms for more than 2 years. The initial number of long COVID symptoms was 20 and a half. Although there was a difference between the sexes, males had a mean of 17.6, females had a mean of 21.6. And when we added in the severity, the difference between males and females was even greater. So the initial long COVID score for males was about 31, whereas for females, the average score was about 40.5. So in general, females tended to have a few more and have a little bit higher average severity of symptoms than males. Now, most participants, like over 90%, were taking supplements prior to the study, and we encourage people to stop all their supplements because they're potential confounders in a clinical trial. We're trying to assess 2 different degrees of intermittent fasting, and we didn't want people taking these mitochondrial support supplements. There's a whole boatload of them. We didn't want them taking any of those things. So what did we see? We saw on these weekly symptom surveys, including the initial survey, we saw flare-ups, lots and lots of flare-ups. The number one attribution for flare-ups was overexertion. I don't think that surprises anyone dealing with long COVID or long vax. The number 2 most common reason for flare-ups was water fasting. So that may surprise some people, but we expected that, and we warned participants when we enrolled them, that they might have a flare-up of some of their symptoms or all their symptoms, either during a water fast or more often after refeeding from the water fast. And that's a really interesting phenomena that I could speculate about, but right now it's just enough to mention it. The third most common attribution was emotional stress. So no surprise there. When you're really stressed out, your immune system gets compromised, and it's not good for your long COVID journey. Not surprisingly, a whole bunch of people did not know what caused their flare-up. I think that doesn't surprise anyone with long COVID either. And the duration of symptoms could be 2 to 8 hours, 9 to 24 hours, more than 1 day, or 2 days or longer. And I'll tell you, a few participants, had their flare-ups could go 3, 4, or 5 days, or maybe even longer. So also on the weekly symptom surveys, participants reported serious or concerning health-related events. And interestingly, most of the flare-ups were not considered serious or concerning. They were just kind of routine from the long hauler perspective. We did, but occasionally they'd have a more severe flare-up or a brand new symptom, or other health event, and that would get recorded as an adverse event. And so of all the adverse events, almost 1/3 were potentially related to fasting or triggered by fasting. Okay, so everyone had an individual different journey through the trial. I mean, some people were really good responders, some people didn't respond at all. Just to give you a feel for that, here's the journey of two subjects. Subject 322, was a young female. She had a lot of symptoms and more severe long COVID severity score to start with. She got worse during the first two weeks of just eating in a 10-hour window on a no sugar diet. But she had a lot of ups and downs, and she reported 4 overexertion flare-ups and 1 menstrual cycle related flare-up. So that creates a lot of noise. But still, you can see during the fasting 4 weeks, she started at a score of 70 and ended at a score of 42. And during just the following time-restricted eating 4 weeks, her delta was 42 to 24. So some people were, very consistent. Some people had a lot more ups and downs. And subject 248 appeared to be one of these consistent people. He had a nice decrease in the first 2 baseline weeks. And then he was showing some signs of decreasing after his first 3 weeks of once a week fasting. And he was one of these people that was gung-ho and was doing the 2-day fasting. And after his 4th water fast, he was experiencing some insomnia, but he had made plans to move from Pennsylvania back to Texas. And so he loaded up his car and drove nonstop to Texas, and he overexerted himself, and he had a major flare-up of his symptoms, and we can see that on that week's symptom survey. So his severity score went from 5 the week before to 30. So major increase in symptoms and severity. Unfortunately, this kind of messes up the well, his results make it look like fasting was no good and that the time restricted eating was great, because he promptly came back down to the low single digits. So this just shows you the challenge of doing a study like this, where the symptoms are variable from week to week and we can have major flare-ups. Basically, this young man was what we call a confounder, kind of messed up our results, but fortunately we did not have too many people like this. So what did we see when we look at the 2 different groups? This is, circled in gray is the group that did time restricted eating for the first 4 weeks and then the fasting 4 weeks. And you can see that, both groups, their mean long COVID severity scores decreased a little bit in the first 2 weeks. But then the ones that just continued on with the no sugar diet and the 10-hour time restricted eating, they pretty much leveled off, maybe a slight decrease. But then their symptoms took a big, on average, increased quite a bit over the fasting 4 weeks. So this was what we were hoping to see. These 2 lines diverge and then they partly converge again, meaning that the fasting treatment was more effective for long COVID symptoms than the time restricted eating. And participants did lose some weight. In general, the people that were overweight lost more weight, whereas the people that were already at a healthy weight lost much less weight. And we didn't allow participants to enroll in the study unless they had a BMI of 20 or higher. So 18.5 is generally considered the threshold for underweight. So in this crossover design, one thing that can blow up the statistical analysis is if the uh, the treatment from the first 4 weeks carries over into the second 4 weeks. And we actually saw a little bit of that from the fasting 4 weeks into the non-fasting 4 weeks. So here you can see the scores continued to decrease for the two time-restricted eating weeks. So we don't know if that was due to confounders or if there was like some kind of delayed benefit from the fasting. I think maybe for some individuals there is a delayed benefit. But fortunately, we did this two-way ANOVA analysis, and we did not have statistically significant carryover between the two treatments. So, phew, big sigh of relief. We get to do all our statistical analysis. And what that showed was that in the when we use our long COVID score or long COVID severity score measure, we saw a small decrease on average. This is the mean, minus 2.8 versus a change of minus 10.2 for the mean change in the fasting group. Of course, there's a lot of individual variation. Each of these diamonds is, you know, the change that a participant in the study saw. So, you know, some people during the time restricted eating 4 weeks got worse, some got better, but the mean change was minus 2.8. Kind of a little bit less variability in the fasting 4 weeks, but again, the mean change was minus 10.2. And statistically, comparing both these data sets, we got a nice statistically significant p-value. Okay, we saw something very similar with it when we used just counted up the number of long COVID symptoms. So in the time restricted eating 4 weeks, on average, 1.4 symptoms went away. And in the fasting 4 weeks, on average, 5 symptoms went away. And when we pair up the severity scores for every participant, and so the gray is their starting score, and the adjacent blue line is their ending score at week 10. We kind of get this piano graph, and there's kind of 3 blue keys that jump out right away. And that means, unfortunately, those 3 individuals got worse during the 10 weeks of the trial, not better. And there's another 3 individuals that basically had no change. So not everyone was a good responder. But you can see by all this white space in between the gray bars that a lot of individuals had a lot of improvement. And some had really dramatic improvement, and they were kind of scattered throughout the severity spectrum. So it appears at first glance that no matter what your initial starting severity, you might still be a really good responder kind of percentage-wise. And I was always thrilled to see individuals get into the single digits, especially into the low single digits. So what symptoms improved and how much? Well, I'm going to show you via these box and whisker plots. And basically every black diamond here is an individual. So regarding blurry vision, for example, no one reported severe blurry vision. One person reported serious blurry vision. A lot of people reported moderate blurry vision. Some reported mild. And I'm excluding the people that were like 0-0 on their initial survey and their final survey. So there aren't 58 diamonds here because, you know, some people didn't ever have blurry vision. Okay, but basically at week 0, the initial time point, most people had mild or moderate blurry vision if they had blurry vision, and this shaded region is the kind of the middle 50% range. So that's highlighted there. 10 weeks later, the middle 50% range was, between 0 and 1. So a whole bunch of these people with moderate blurry vision moved down to mild or none. And basically, statistically, this was highly significant. This does not happen by random chance. And we saw similar patterns for every single of the 28 symptoms that we tracked for severity. They have some unique patterns, but nearly every symptom, this interquartile range decreased at least a full step in severity. And so here are the most common symptoms that everyone's familiar with: fatigue, post-exertional malaise, difficulty concentrating, brain fog, insomnia or sleeping difficulties, difficulty in finding the right word. And you can see that at a glance that fatigue and post-exertional malaise had the highest average severity. So a lot of people had serious fatigue. A lot of people had serious post-exertional malaise. But 10 weeks later, the interquartile range had moved it down. So, quite a few people had no fatigue, or quite a few people had no post-exertional malaise. But still, the majority of people had moderate fatigue or moderate post-exertional malaise. And some of these cognitive issues, like difficulty concentrating, were like really dramatic improvements over the 10 weeks. Similar pattern for brain fog and difficulty finding the right word. So basically, no matter what the common patient-reported symptom was, we saw this interquartile range, or the average severity, decreased about a full step. Sometimes more, sometimes a little bit less. So joint pains, heart palpitations, leg weakness even. Some of the POTS symptoms or MCAS symptoms. Shortness of breath was a really good responder. Ringing in the ears and nerve pain were a little bit more difficult to completely, or a little bit less likely to completely go away, but they responded as well. Okay, so when we look at the change, instead of comparing the 4 weeks of time-restricted eating to the 4 weeks of fasting, if we, as a secondary analysis, we could look statistically at the change in symptoms over the entire 10 weeks. And when we did that, remember that the average number of symptoms initially for everyone was 20.5, although some had like 38, some had 11, and half the people had between 14 and 28. I mean, that's a lot of symptoms. And 10 weeks later, the average or the mean was 12.2. And you can see there was a number of people down here in the low single digits. Even a few individuals that were ended at 0. And this was very highly statistically significant. This shows the initial frequency of the 28 symptoms versus the ending frequency. So, like as I said, all these symptoms decreased on average about a full step in severity, but because fatigue and PEM started off at a higher severity, they were less likely to go away completely. And on average, these symptoms went away at a frequency of, I think, 41 or 42% of the symptoms went away completely. And in our additional 32 checkbox symptoms, 40% of those went away completely. Okay, so we were fortunate to have enough statistical power that we could even do some interesting subgroup analyses. So if we stratified all the participants in the trial based on age and put them in a bucket that's 48 or older, or a bucket that's 47 or younger, we found that the younger age correlated with the better 10-week response in the trial. So their mean response in the younger age group was a decrease of 71% in their long COVID severity scores versus a mean decrease of 44% in the older group. And really, these groups aren't all that different, except the 7 worst responders or non-responders were all in the older age group, whereas the 4 very best responders were all in the younger age group. So that's a clue as to what's going on with the pathobiology. And one thing that, to me, that suggests, my training is in cell biology and immunology, to me that suggests that having a highly functional immune system, which is being associated with younger age, is a positive thing for fighting long COVID. Interestingly, better 10-week responses were not associated with gender, their initial body mass index, their initial long COVID severity, or the duration of long COVID. And not to say that there wasn't any correlation, but none of the correlations were weak enough to be strong enough to be significant. And very interestingly, the people that said their symptoms first started soon after a COVID-19 vaccination were generally good responders, although that was not as strong a positive factor as younger age. So in summary, we were comparing the more intense 4 weeks of once a week fasting to the less intense intermittent fasting regime of eating in a 10-hour window per day. And everyone was on a no sugar diet through the entire study. At least we had pretty good participation in the diet. And the number of symptoms decreased more in the fasting 4 weeks than the time restricted eating 4 weeks. But the really exciting thing to me was like the magnitude of the change that we saw over the entire 10 weeks. And we had a 52% decrease in the mean long COVID scores for everyone, and with a corresponding 41% decrease in the number of symptoms. And that's tracking all 60 symptoms. Of course, this is no good if it's not safe, if it's too hard to do. We actually had a few people drop out in the study, but not very many. We excluded a few participants from the analytic group. And generally, the most common reason for that exclusion was because they started fasting too early, or they did an extra fast. So they had to attempt 4 fasts within just the right 4 weeks. Otherwise they were likely excluded. So we had one overnight hospitalization that was definitely fasting, appeared to be fasting flare-up related. It was on the morning of her second fasting day. I think she was going to stop fasting, but she went into the hospital and she ended up not eating anything and basically fasting for another day. And she had a sudden flare-up of the left side lining of her lung and tendonitis in her arm. And it scared her. She could hardly straighten her arm, and it was painful. She was given a short course of steroids, and her pulmonologist said, "Oh, I've been seeing a lot of this," and she responded very well to the short course of steroids. She badly wanted to continue in the study. We allowed her to continue, and she ended up being a very good responder. So we did have a lot of concerning or serious adverse events, but upon medical review, none of them were considered major safety events. So just to give this a little perspective, I consider this a ray of hope. I mean, finally, a positive long COVID clinical trial. Not only that, but for the really badly gaslit post-vaxxers, hey, this works for them too, or may work. And for the top half of responders, the overall decrease in the long COVID score was minus 80%, with a 71% decrease in the number of long COVID symptoms. So that's pretty amazing. This is not a cure. I've been doing lots of this myself for 5 years, and I still have symptoms. The durability of improvements is unknown. Unfortunately, we didn't follow up with participants, a month, 3 months, 6 months later. Anecdotally, some people are able to hold on to their gains. Some are not. And I just have to say, as a long hauler, I know not everyone is able to safely fast for a whole variety of reasons. And particularly type 1 diabetics should be careful because they're more likely to have dangerously low blood sugar during a fast. And pregnant and nursing women, people with a history of an eating disorder, fasting isn't a good option. So I think we need lots of follow-up on this with larger fasting trials, with blood draws for biomarker, metabolic and immune analyses. And personally, I think it would be great to trial potential fasting mimetics, things that might have a similar effect without fasting. So like maybe taking the C8 caprylic acid, which is an MCT oil, just 1 day a week might be as good or nearly as good as doing a once a week water fast. I don't know. Nobody will know until we do a trial. And of course, like any scientific study, while this is an exciting result, it raises a lot of questions. Like, why is this working? Is it a reduction in inflammation? Is the fasting killing off these inflammatory senescent cells? Is it improving cellular metabolism? Is it enhancing tissue repair? Is it actually helping individuals' immune system clear persistent SARS-CoV-2 virus? These are good questions, and the answer is we don't know. Now, knowing long haulers and their desperation to get better, I just want to caution people that we do not know the optimum duration of fasting. Here you can see that participants varied in the length of their total fasting hours over the 4 weeks of that intervention. So on the right here, we had a few individuals that fasted about 250 hours total. And we had a couple of individuals that only fasted about 100 hours total. Most people were about 160 hours. And when I do this linear regression, it's flat, which means the people that went to all that effort of fasting for longer didn't see any additional benefit compared to those that fasted for shorter durations. So this is not the last word on the subject, but in my opinion, from this data, there's no need for people to fast longer than a night, day, night to see, to have a chance of getting good results. Okay, I'm going to do some acknowledgments. This was an unfunded all-volunteer clinical trial. And to even imagine doing something like that takes a lot of positive thinking, and there were a lot of hurdles. It took a lot of I think I can, I think I can. And like I kind of provided the big iron pot and some of the fire. And fortunately, I teamed up with my co-investigators, uh, particularly Dr. Jeffrey Novak of Pacific Northwest University Health Sciences. He's a pharmacologist, an immunologist, and he teaches medical school there. And it was wonderful to kind of mind meld with him, and he opened the doors and made this, contributed and made this possible. And I also was fortunate to team up with Benjamin Horn, who had done a number of interesting fasting related trials and was a statistical whiz. But most of all, I want to acknowledge the tremendous efforts of all the very sick long COVID and long vax participants that kind of went out on a limb and said, hey, I'm going to make this a top priority. And daggone, I'm going to try this. And, you know, even with limited energy, insomnia, cognitive issues, you know, the majority of them were able to successfully enroll in the trial and complete the trial. So thank you very much for all the participants, and hearing their stories was absolutely incredible, particularly the stories of the long vaxxers, those whose symptoms started suddenly after vaccination. Unbelievable, tragically sad, the gaslighting these teachers and nurses have endured, because they were just totally dismissed by their healthcare professionals, and in some cases, these were their peers. So with that, I'll end, and I imagine I'll do a follow-up talk or session, but I do have a website, Diet and Fasting for Long COVID, where I'm going to plan to put out more information, and a protocol where, you know, that you can look at and talk with your doctor if you want to potentially try something similar to what we did in the trial yourself. All right, thank you.